welcome back to Mirror Interpretation to Droba. Welcome back to my YouTube channel. My name is Joanna and I'm an interpreter, and I'm recording another medical interpreting practice for you that like to practice and experience how it's like to work as a consecutive medical interpreter. Before we start, you can join me for $3.99, where you can practice weekly with me. In these practices, I speak in all the languages I know, medical terminology, and then once a week, once a month, I respond to your questions for members only. Said that, we are going to start a recording called life insurance. This is a medical interpreting call. I did took the private parts out of it, and we are going to exercise together. I'm just trying to start my timer so we can do this exercise together. This call have a lot of medical terminology, so guys, be ready. That's a real call. If you do the life insurance screenings, that's how this would look like. So you have to be ready. Said that, do prepare notes, do prepare a pen and paper, whatever way you like to take notes. And we're gonna start with our session. 3, 2, 1. Did you have any problems with your thyroid gland? No. Do you have any hormonal disease? No. Do you or have you ever had any breast disease like breast cancer, cyst, and so on? No, no. Have you had any prostate problems or disease? No. Do you have any disease of your male reproductive organs or male glands and functions? Do you suffer from diabetes? No. Have you ever had sugar, protein, or blood in the urine? No. Do you suffer from hepatitis A, B, or C, or have you ever had it? No. Have you ever had any liver disorders and disease? No. Have you had kidney disease or kidney stones? No. Do you have any disease of your bladder? No. Do you have any eye disease besides myopia or similar, like serious illnesses? No. Have you had any STDs beside small infections, something like HIV or infections in the blood? In the last 5 years, can you please tell me, have you received treatment or help from a medical specialist or a doctor for the second disease? This is the interpreter speaking, ma'am. You can give me a few conditions at the time, please. Thank you. Chest pain, irregular heart rate, constant skin lesions, immune system disease, for example, where your glands enlarge and become very big. No, not at all. Fainting and headache. No. Have you been hospitalized in the last 5 years or receive any treatment or consultation with any medical specialist? Yes, I was 6 months ago when they put a stent on me. Then I was at the hospital. Okay. And did you know where they put the stents? In which hospital was that? Somewhere close to me. I don't remember which clinic exactly. Maybe it was Ombri or something like that. Oh, okay. I will write it down. Thank you. And were you in the hospital for some time, or how was that like? Did they just admit you? Yes, I was in the hospital for 2 days. First day I went, they put the stents, and the second day they discharged me. Oh, yes. Okay. And did they diagnose you at the same time? Yes, of course. Oh, I understand. Thank you. And in the past 5 years, have you done some and not limited to those tests? There will be a test for your health like EKG, a radiogram or X-ray, CT scan, or any kind of a scan or a blood test like a lab test. Yes, I did. I have done this electrocardiogram to my heart. After they put the stents to my heart, they wanted to make sure everything was okay. Did you do a blood test? Yes, I don't remember that type of test. I remember the electrocardiogram they did. Maybe I did the blood test, but I don't remember. And this electrocardiogram, did you do it 6 months ago or after they put the stents? No, it was after they put the stents, about a year and a half ago or something like that. Okay. And besides what we discussed in the last 5 years, did you take any kind of medicines? Yes, I do take medicine. I take baby aspirin, the blood thinner. Then I take fish oil and I take a medicine for cholesterol. After they put my stents, they prescribed me this medicine to control the cholesterol, and that's it. Okay. And do you know how it's called, this medicine that you take for the cholesterol? If you want, I mean, I can check with my daughter. She's studying for a nurse. She completely take care of this, and I don't know the names exactly. She purchased it for me and everything. I can't tell you the name, but I can send you an email with that information afterwards if you like. Um, Let me think about it. Or maybe you can call me a little bit later and tell me the name of those medicines. Is that okay? Okay. Okay, so when my daughter comes home, she would find the name and we will call you. I will call you next to her, and so she can tell you all the names of the medicines. I understand. Thank you. And thank you guys for being here. I decided to cut this in 2 parts because it's really long, and who doesn't have experience in interpreting may get a little bit challenged here. Said that if you guys like this video, don't be shy, press like, and I hope you enjoy it, and I hope I was better with the timing this time, although I am not always so I'm always not so good to do this. I want to say thank you for being here. Thank you for subscribing to my YouTube channel. Thank you for supporting me. And I appreciate you guys being here, and I hope this video is useful to you. Said that, I really wish you a wonderful day, and bye-bye.